Good morning, everyone. It's 10 o'clock and we're going to start right away. We have a lot of information to share. We welcome you to working with the LGBTQ plus community in rural settings. A few brief housekeeping items. Everyone is muted, but the question box is available throughout the webinar for you to post questions, and we'll monitor and answer in real time as we can. We also have we'll leave a few minutes for questions and answers at the end if there are broader questions. Also, the webinar is being recorded and will be posted to Partners, Rover, and our Rise and We Breathe sites. So I'd like to have our presenters introduce themselves in the order you see on the screen, and let's start with We Breathe.
Good morning. My name is Danny Sesenia. I am the program coordinator for We Breathe, and my pronouns are he, him, his.
And hi, my name is Amanda McAllister Wallner. I am the program director for We Breathe, and my programs are she, her, hers.
Good morning, I'm Shelley Brantley, project director for RISE, Rural Initiatives Strengthening Equity, and my pronouns are she, her, hers.
Hi, I'm Emily Goldstein. I'm the North Coast Regional Coordinator for RISE, and my pronouns are she, her, hers.
Hi, my name is Megan Armstrong. I'm the project director for Butte County Public Health Tobacco Education Program. My pronouns are she, her, and hers.
Good morning, my name is Ty Polskamp. My pronouns are he, him, his, and I am a board member of the Tri-County LGBT Alliance, which serves Calaveras, Amador, and Tuolumne counties.
Good morning, this is Michelle Opalenik. I'm with Tobacco Reduction, Amador County. My pronouns are she, her, and hers.
So let's talk about the purpose of the webinar and how this came about. Danny, would you share about the technical assistance requests you've been receiving?
Absolutely. So We Breathe has been receiving LGBTQ 101 training requests from different coalitions and departments of public health throughout the state of California. And once we started receiving rural requests, We Breathe realized that we couldn't do all these trainings alone, especially because, particularly me myself, even though I identify as LGBTQ, I was not raised in a rural setting. So I went to Shelley asking if we could collaborate. Shelley, would you like to talk a little bit more about our collaboration?
Yeah, Danny, and I really appreciate you reaching out to discuss how we could best provide technical assistance to our rural partners. You know, I knew I could provide perspective on working and living in rural communities, but I couldn't provide the LGBTQ plus insight. So Danny and I knew we could work together to combine our expertise to provide the best possible information. And Danny and Amanda and I had several conversations about how best to move forward, how to get the information to the rural projects that were asking for technical assistance. So we decided to, after several conversations, to put together a webinar, much like we're providing now. And we would ask LLA staff, coalitions, and partners to join with local LGBTQ plus folks in their counties at their community centers, clinics, or LGBTQ friendly spaces for what we were calling a lunch and learn type webinar viewing opportunity. Allies meeting at a safe space with members of the population to learn together sounded like the perfect public health strategy. OMG, Danny, our PCs were going to love us. So I presented the plan to the Rural Issues Work Group, and way too much, way too soon. So today's webinar is us stepping back, adding more voices and experience to our group by bringing in Michelle and Ty and Megan and Emily, and really listening to the rural projects to determine what their needs are. And they told us to start with the basics and provide tools and examples. Already there are lessons learned when working to bring the two population groups together, and this webinar attempts to provide the information requested in a more familiar format before we move on to community outreach. So the agenda today will look at the why and the how of working with the LGBTQ plus population in rural communities, but we need to start with a common language and understanding of terminology. Then we'll discuss the various barriers LGBTQ plus people face in rural environments. At the end, there's also a resource section available on this webinar, and you also have resources at your disposal that you can download at any time during this webinar, or will also email. You'll receive a post-webinar email that will have the documents available to you at that time. So let's get started with terminology.
So let's start by talking about some of the basics of LGBTQ plus terminology so that we can all have a shared language during this webinar as well as going forward in our work. So let's start by setting a foundational understanding of the difference between sex and gender and explain some of the terminology related to the two concepts. So sex is what you're assigned at birth. It's typically based on the appearance of your genitals. And although we may think of sex as a binary, only having two options of male and female, this is in fact not true. Intersex is an umbrella term used for a unique variation in reproductive or sex anatomy. And some intersex traits are identified at birth, while others may not be discovered until later in life or during puberty. So while sex is often based on the appearance of genitals, gender is an internal understanding of your own experience of the world and how you fit into that. And if we think of a basic understanding of sex as what you have between your legs, then we could say a basic understanding of gender is what you have between your ears or what's in your brain. So while we're often told that sex and gender are synonymous, they're in fact two very different things and not at all connected. Your sex does not determine your gender, and your gender does not determine your sex. A few of the definitions up here. So trans people are people whose gender identity and or gender expression differs from what's typically associated with sex with the sex that they were assigned at birth. Non-binary describes any person whose gender identity does not fit within the binary spectrum of woman and man. And sometimes non-binary identities may also have cultural ties. So you may have heard of the term like two-spirit, and those are more culturally related. And then cisgender people are people whose gender identity is congruent with what is typically associated with the sex they were assigned at birth.
So when we talk about gender identity, we all have a gender identity, and it is our most inner sense of self. It's who we are on the inside. It is how we identify. And the way we identify within ourselves is we express it out to the world. And that's what gender expression is. And again, we all have a gender expression. It's what we put on every day, what clothes we wear, what accessories that we wear. And this is what affirms who we are within our gender identity. Now, when it comes to the transgender umbrella, there are over 265 variations of gender identity. Please don't quiz me on 265 variations because I don't even know them all and I'm trans. But each and every day, I'm even learning brand new terminology. And that's what this is about. It's about being open-minded and being willing to learn something new each and every day. Now, the transgender umbrella, it can be very binary, such as male to female or female to male, or it can be very non-binary or gender non-conforming, such as, androgynous, gender diverse, feminine man, masculine woman, and such.
So now let's talk a little bit about orientations. So orientation can refer to our sexual attraction or and it could refer to a romantic attraction. So lesbian is a woman who's attracted to other women, and gay is a man who's attracted to other men. Those are typically terms we've heard before, some of the more common ones. And gay can also be used as an umbrella term for the LGBTQ community. You may hear that sometimes, but something important to note is that lesbian and gay refers to somebody who's attracted to people of their own gender, and this does not have to mean their own sex. And then bi and pansexual are both very closely related terms, and they refer to a person who's attracted to people of many genders. And queer is similar to this, but it may have an added socio-political context. And again, queer can sometimes be used as an umbrella term for the LGBTQ community. And then asexual and aromantic, which both terms can be shortened to the term ace, refers to a person who's generally not attracted either or romantically or sexually to another person. And the ace spectrum includes many identities, and a person can be asexual and not aromantic, or can be aromantic and not asexual, or they could be both. So now we want to give you a visual representation of everything we've been talking about. So this is the gender unicorn, and it lays out the way that all of the things we've been talking about fall onto a person. So we can see gender identity is how you see yourself in your mind. Your gender expression is how you present yourself out to the world. Your sex is based on the appearance of your anatomy. And then your physical and romantic attractions are what you feel in your heart. And then we wanted to kind of give you more of an example even further. So Danny and I have both filled out our gender unicorns so that you can see examples of what this could look like on people of two different identities. So I'm a cisgender queer woman. You can see up in my gender identity, I think of myself mostly as feminine, as a woman. I do honor some of the other parts of me, but the most over here is feminine and woman. The way I express myself out to the world out here aligns with that. I'm dressed in very feminine clothing mostly, things that society would typically assume are meant for a woman. At birth, I was assigned female. And then for me, my physical and emotional attractions do align. This isn't the case for everyone. And I'm primarily attracted to women and then people of other genders, non-binary people.
For my gender unicorn, you will see that in my gender identity, I am mostly inherently male. However, I still identify with some parts of my feminine side and non-binary genderqueer side as well. And even with my gender expression, when you see me at conferences and meetings, I very much present as masculine. However, in my everyday life, you will still see some feminine parts of me, even though I was assigned a female at birth. Now, who I'm physically attracted to, I'm attracted to all people, whether they're male, female, or other genders. However, when it comes to emotional attraction, I'm very much emotionally attracted to women. That's who I tend to date. That's who I'm married to. I'm married to a cisgender bisexual woman. A lot of people think like, okay, well, because you're trans and you identify as male and you're married to a woman, does this mean you're straight? Absolutely not. A good thing to remember is that gender identity is who you go to bed as. Sexual orientation is who you go to bed with. And this gender unicorn really lays that out beautifully. So that way you can kind of see where my gender identity and who I'm attracted to and emotionally attracted to are both very different. Now, we know that this 101 was very brief, and you probably have a lot of questions and want a more in-depth training, and we would love to help you find that additional training. So you can always reach out to your local LGBTQ centers, LGBTQ-owned businesses and such. They're always having 101s, or you can even invite them into your coalitions. If you're not sure how to reach out to your local LGBTQ community, you are more than welcome to contact We Breathe, and we are happy to provide those introductions. In the handouts that you see in your little toolbar, you will find a one-pager about We Breathe and the Rural Statewide Coordinating Center, as well as copies of the Gender Unicorn, the importance of utilizing pronouns, as well as an in-depth resource list. So we highly encourage all of you to please download those handouts, or you can receive them in your email, so that way we can help you move forward with engaging the community.
And so talking about very specifics of the how, Danny mentioned it briefly, but we know that living in a rural community means supporting one another and sticking together as a community. This includes building relationships with more marginalized groups. Some rural locations will have a well-known LGBTQ community or pride center, but we know that most rural areas are not lucky enough to have an organization like this that has great and easy access to building relationships and starting that process. So we encourage you to walk in. If you do have such a center, walk in or call to schedule a meeting with the appropriate person. Introduce yourself using pronouns and let them know you're open and you want to learn. And Michelle and Ty will be talking about how they started that process. But as I said, many rural communities don't have this type of central hub. But that doesn't mean that the LGBTQ plus people and community does not exist in your area. You can look to connect with local LGBTQ plus owned businesses, or look online and try and find LGBTQ plus online groups in your area. And Facebook groups are a good place to start. But it's important to remember that many LGBTQ plus individuals have long histories of experiencing homophobia and transphobia. Groups, organizations, or individuals may be wary of outsiders. If you're not welcome into an LGBTQ plus space or are asked not to participate, please do not take this personally. Graciously understand the history of trauma that accompany this type of request. So now let's look specifically about some barriers LGBTQ folks face in rural areas. But before we dive too deeply into barriers, I want to provide a little bit of context. And I apologize for the blurry map there, but I'm using Amador County as an example of population and geography because that's where our guest speakers live, in Amador County, which is a county of with a population of less than 40,000 people. So the map shows Amador in relation to its neighboring rural counties and its proximity to Sacramento, which is most likely where folks have to travel for all but the most basic care and services. And we've all heard it. Where you live impacts how you live and how long you live. We'll be talking a lot about access. Lack of healthcare facilities is only one of the many barriers faced in rural areas. If there is healthcare available, it might be difficult to reach because of a lack of public transportation or a lack of reliable personal transportation, long travel distances, weather, etc. So rural residents have a lower life expectancy than those in urban areas. In part, it's due to poor access to health care, such as a lack of primary care and specialist healthcare providers, and the closure of local community hospitals. 20% of the US population lives in rural America, but only 1/10 of the physician workforce practices in rural regions. This also means rural residents lack access to health education, behavioral counseling, social interventions, mental health services, addiction treatment, all things that might be taken for granted in an urban setting. So let's look, how does living in a rural area impact tobacco use? As just mentioned, rural residents have less access to healthcare-related resources. They also experience a higher incidence of various diseases, including tobacco-related diseases. What are some factors in rural tobacco use? If you look at the story of inequity on Tobacco Free CEA's website, the tobacco industry has long targeted rural communities. And they target those communities specifically with images and messages that resonate with rural citizens. Strength and independence are often seen as inherent parts of rural values and community. Tobacco companies use the commitment and belief in these values to market their products to people in rural areas. They target these communities by appealing to notions of self-reliance and resiliency with images such as cowboys, hunters, and race car drivers. But we know rural communities have some of the highest smoking rates in California. That leads to higher rates of lung cancer. And rural residents start smoking at an earlier age. But what if you're LGBTQ plus and living in a rural area and a member of an ethnic group that is not the majority ethnicity? Megan will now provide examples of how these points of intersection impact tobacco use in rural areas.
Thank you, Shelley. Before we jump into that intersectionality, we want to talk about how many queer people actually live in rural settings. The stats here are taken from the Movement Advancement Project from April of 2019, where we call home LGBT people in rural America. And what that report found was that between 3 and 5% of the rural population identifies as LGBT. 4.5% of the general US population identifies as LGBT, and roughly 10% of youth in both rural and urban settings identify as LGBT. When taken together, that suggests between 2.9 and 3.8 million people, LGBT people, live in rural areas around the country. Not only do they live in rural communities, but they want to. They choose this because they enjoy living there for many of the same reasons straight and cisgender people do. It can be just as much as part of their identity as being LGBT. Like Shelley said, it's important to remember when you embody these identities, rural and LGBT, the disparities and barriers mentioned in the last slide and the next few tend to increase as if you're also a person of color.
So we know that rural communities are often small and closely knit, and it can sometimes seem like everybody kind of knows everyone else. And for LGBTQ people, this can mean that they're more visible and therefore more at risk for discrimination, homophobia, and transphobia. And this can make it hard to find supportive environments within one's own community. And in rural areas that already have limited resources, discrimination can limit those resources even further for LGBTQ individuals. So one of these resources that is extremely limited is access to healthcare. And healthcare is one of the crucial resources that LGBTQ people in rural areas may struggle to access. Only 11% of LGBTQ adults living in rural areas have access to LGBTQ specific healthcare, and this is compared with the 57% of LGBTQ adults living in urban areas. We also know that LGBTQ individuals experience homelessness at higher rates than non-LGBT individuals. And this is exacerbated for LGBTQ youth living in rural areas. So LGBT youth who are 2.2 times more likely to experience homelessness than non-LGBT youth. And again, as Megan was saying, when you add the intersection of racial oppression to someone's lived experience, this problem becomes even worse. Black LGBT youth are 4 times more likely to experience homelessness than white non-LGBT youth. So overall, it's clear that LGBTQ people face daily stresses from discrimination related to homophobia and transphobia, and the daily survival becomes harder. And then this is clear why people may turn to coping methods such as smoking, or why if they're already smokers, quitting can become incredibly hard. And we know LGBTQ and rural populations are both targeted by the tobacco industry and face unique stressors that create higher smoking rates and health disparities in these communities. So today, we're lucky enough to have Ty with us to share his story of growing up in a rural area as an LGBTQ person. Thank you so much for being with us and for sharing your experience with everyone, Ty.
Thank you for this opportunity and for the work that we're all putting into getting rural queer youth the accessibility and the space that we're discussing right now and access to healthcare. Good morning again. My name is Ty Polskamp. I grew up here in the rural foothills of the Sierra Nevada, southeast of Sacramento and northeast of Stockton, about an hour from both of those cities, and out here in what we call the county. Early on in my childhood, even before school started formally, it was evident that my fashion choices and my vernacular were threatening to the adults in my area. And so what I learned coming into school, as my peers, parents, and the administration was hard on censorship, I learned sort of to keep to myself and to steer clear of the power structure of school itself. But thankfully, I am blessed to have grown up in a bold and unapologetic ethical family full of dynamic communicators. So in that space, I was encouraged to listen to many ideas at once and to learn to speak from my own voice in an environment that celebrated us for our own unique perspectives. So moving through public education and group activities such as the Girl Scouts and dance lessons, my community left me feeling a heightened sense of scrutiny, both from my peers who seemed to be at the direction of their parents, and then just an array of adults sort of scrambling to gain control over what they seemed to be threatened in me by. So by about the third grade, there was a peer's parents who pulled me aside and told me that I had ruined her kid's school picture. I had around 4 years old started wearing a neon pink baseball cap backwards, and that hat caused a great deal of controversy throughout my childhood. So because of the supportive nuclear and extended family that I had, even at that young age, I had the strength of character to know that that adult was wrong, both that what she was saying was incorrect. I looked great in that picture, and that she was wrong to be approaching me in that way. But what I couldn't tell at that time was how those type of statements would serve to shape, my ability to process as an adult. So the hat and later my hair, they seemed to possess this power over the people around me that made them think they must take some sort of action against me, persistently attempting to sort of squelch something within me that seemed to shake them off their access. So I got a lot of practice early on for self-advocacy. And on through junior high and high school, the classroom and the schoolyard community and the community at large became increasingly dangerous as puberty, dictates its own sort of list of do's and don'ts. What may have been excused as useful spunk or creativity in my presentation as a young girl became threatening to the entire flow of social progress as a teen. So suddenly I was being bombarded with this, questions like, are you a boy or a girl? Which, having gone through school since daycare, basically with the same group of kids, was, all the more disconcerting because no one really was asking that question. They were just kind of insistent that I wasn't living up to the expectations that the community had around me. So as a result of this policing, I really was sort of driven to the fringes, putting myself at a lot of additional risks that adolescents face, like self-harm, and dependency, like chemical dependency. So I learned to engage in these tactics to both to preserve my, any sort of sense of self through navigating that, and then to kind of gain social value. I would do things like steal cigarettes and have them for people that I knew that they wanted them, and that kind of thing, just to keep kind of ease the tension of being obviously like the queer person in my region. So my peers knew that I was queer before I did. I just thought it was fabulous. Though the language accessible at that time, especially out in the country, didn't exactly have room for a gender nonconforming young butch girl who would grow up to be a man. There was no language for that. I didn't even know the word transgender until I was already 18 years old. They just called me faggot. So they knew that faggot was something negative, and what they were perceiving me to be was something negative. And so that was kind of the way that I was referred to through the last 2 years of school. So having been exposed to physical violence and verbal threats, daily harassment on and off campus, I recoiled from academics altogether and was simultaneously instructed by school administration to not attend school events after I had somewhat jokingly been nominated as homecoming king back in 2001. So after my tires were slashed on campus, I was really just holding my breath, and somehow managed to escape what certainly felt like being hunted, and graduated and moved away the next day. So having had that early childhood exposure and lots of practice for self-advocacy, landing in my little college town, all I knew how to do was kind of organize and try to make a positive impact and access my queer community. And so over the 10 or 15 years that I lived out of the area, that's what I did. And I was always finding that I was doing the same type of hustle to manifest the resources that I needed in small cities and then eventually in the county of Sacramento, and having this sort of sinking feeling in my stomach that no matter how much work I did out of the area, when I went home, that work wasn't going to be done unless I went home and did it. And so basically, having kind of tried to find community around these cities, I realized that my identity as a rural person is just as strong for me as my identity as a queer person, as a transgender man, and that being in my rural region was going to be more fulfilling as an organizer than bouncing around in these city circles. And so that's what I did. I returned home to the foothills. It's been about 8 years. And in the meantime, have managed to kind of link together folks who are raising LGBT youth, or there's a lot of retirees in my region. And so there's a lot of, partners or people whose partner has passed away already. And so really like kind of just focusing on the simple social survival aspects of what makes the community vibrant and what would meet my own needs, So I've been looking at the local calendar and just choosing to occupy events that are already established with and infuse those spaces with LGBT participants. We circulate resources and create dialogue in social settings like potlucks, so that we can keep in touch with each other and have an idea of what is important to different groups of people throughout the area, so that we can try to meet those needs throughout the year. And that has allowed us to foster these type of community relationships, which puts me out there as a resource for the community, whereas a young person, I was being treated like a threat to the community. And so because of that resource aspect, it's a soul integrating experience. So now I get to be of value to the people who I valued and who helped me to survive against the adversity of small town mentality. And so that was where my name kind of got out into the community, and folks like public health are able to seek me out and try to work with the resources that I have gained and the connections that I have built to get their message to the LGBT rural community. That is a bit about me and what I do here in Amador County.
Thank you, Ty, and we greatly appreciate you being on here, sharing your story, and just the work that you've done and how you've changed that rural setting, honestly, for the better of the LGBT community. So thank you again for sharing all of that. So we're going to move on now to how many LGBT individuals actually smoke. And so what we know from our California data, for California adults, for cigarette use only, the LGBT population smokes at a rate of 17.4% in comparison to 12.4% of non-LGBT adults. Again, this is just the California data. National data from the CDC shows a similar trend, with 20.5% of LGBT adults smoking cigarettes in comparison to 15.3% of adults that identify as straight. Not enough data has been collected for individuals that identify as transgender on a national level. However, the data that has been collected at more local levels, including California, shows a higher prevalence of use among transgender individuals versus the general population. As we move down to the high school level, what we see is that high schoolers that identify in any other way besides male or female have the highest rates at 21.8%. As we go down the line and break that data down, you can see here we have gay or lesbian, bisexual, transgender, queer, intersex, gender nonconforming, gender fluid, and other. Overall, the LGBT high school population uses tobacco at 15%. But if we look at that high peak in the middle with this disaggregated data, we see that intersex or intergender people have the highest rates. Going down from there, transgender, gender nonconforming, gender fluid, and queer, implying that the transgender community as a whole typically has a higher rate of tobacco use than the rest of the LGBT population.
So why do LGBTQ people use tobacco? So it's important to note that the LGBTQ population is not smoking because they are a sexual or gender minority, but because of factors that we have been discussing, and then the factors that we're going to cover in the next few slides. So we'd like to now share a video from the Truth Initiative that highlights voices of LGBTQ individuals and their struggles with tobacco use.
I started smoking really young. I've been a smoker since I was 14 years old, and I'm 40 now. I come from a really small town, but once I went to college, well, there were other gay people there, and they all smoked. By the time I was smart enough to realize what was going on, well, I was already addicted. It's even damaged the relationship between my non-smoking partner and I.
In America right now, 1 in 5 people are smoking. In the lesbian, gay, bisexual, and transgender communities, we have smoking rates that are almost 70% higher than the general population. And why such extremely high smoking rates? In the LGBT communities, the stigma that we experience can nudge anybody towards unhealthy behaviors.
Coming out and not knowing what my life was going to be like, you know, I smoked a pack of cigarettes every day.
It's easy to fall into the trap of smoking. So many LGBT people are already so stressed out about coming out or just living their daily lives.
You experience the isolation from your family, from school members. You're looking for social acceptance.
Add to that the additional stressors of being discriminated against or having your rights denied because of who you are and who you love.
And I think that's what's been capitalized off of. You're not normal, here, have a way to relieve that stress.
We're targeted by the tobacco industry because we're a very easy population to sell to, and we pay them back in decades and decades and decades of handsome profits to their bottom line.
Because it looks like they care about us, because they're sponsoring our events and they're running ads in our magazines, and it's a lie.
Smoking is everywhere. It's part of the fabric of our communities. It's also the #1 preventable health problem that we can steer clear of.
We all have a role to play in being activated for health justice.
And it's going to take a lot of work at a lot of different levels. First step is we need to help the LGBT communities realize we have this huge smoking disparity.
And knowledge can kind of strike the match, but in order to keep the flame going, there has to be support mechanisms within the community.
Part of this solution is going to be our own community members standing up and demanding to be included in health programs that are working on tobacco.
As a smoker, tobacco makes a lot of the decisions for me. I don't want to have to feel like I have to go smoke because smoking has that control. I want to be able to say, I can do what I want.
I have now been smoke-free for about 15 years. Quitting smoking was incredibly liberating. It's time to make a change and save our community and save our own lives.
I've spent 26 years listening to nicotine instead of myself. Yeah, it's time to quit.
Okay, looks like we're back. So something that the video touched on, and is also a really important factor to talk about, is stigma and discrimination. So while our society has improved over the years, there's still a long way to go. And the stigma and discrimination that the community faces is a large factor in the high rates of tobacco use. So one example of the stigma and discrimination is rejection by family, friends, or potentially even someone's place of work. And this rejection can lead to youth being thrown out of their homes or individuals losing their jobs, which can further lead to becoming homeless. Many times youth and adults do not have the healthy coping skills needed to deal with the stress, and then they take on smoking as a way to deal. Stigma and discrimination can also extend beyond personal interactions to the behavior of organizations and governments. And we see this in creating and supporting anti-LGBT policies that impact the community as a whole. So one way we can see this is a lack of access to resources. So as we've been saying, a lack of access to healthcare resources, let alone quality healthcare, is really an issue for the LGBTQ community and for living in rural areas. So according to the Out for Mental Health survey that took place in California last year, rural providers have to refer trans youth to Planned Parenthood in different cities because the local ones don't have doctors in the area who can provide trans services. And travel distances and times can range from about a 30-minute drive to sometimes trips that require an overnight stay. And this also extends to trying to access mental health care as well. So a lack of access to quality care can also mean being misgendered, dead named, which means when you're called your legal name as opposed to the name that you actually have and use, or having your sexual orientation assumed. A lot of times, for example, when you're a person assigned female at birth, the doctor will ask you about birth control needs and insist that you need to be on birth control if you're a sexually active adult, because they assume that you're having sex in a way that you would get pregnant. This also can mean facing inappropriate questions that have little to no medical relevance, or just inferior medical treatment or outright refusal of care. And when it comes to tobacco use, not having quality care means not having health professionals provide essential counseling, cessation medications, and other treatments for smokers. Another really important factor that I want to talk about is bar culture and then social bonding that goes with that. So we also see discrimination and stigma show up in the spaces that LGBTQ people have been allowed to occupy. And historically, bars were among the few safe spaces for LGBTQ people, and they played an important social role in the LGBTQ community for decades, and that continues to today. While rural communities may not have a specific gay bar, some may, some may not, but in some rural communities, a bar may host a gay night or a drag night, something that's LGBTQ specific for the community as a space. And even if there isn't a bar that even holds an LGBTQ specific space, bars can still be some of the only places for people to meet up and hang out. And for all genders and sexual orientations, there can be a biological and behavioral link between smoking and drinking. And this is why people tend to smoke more while they're drinking, or for some people, they only smoke while they drink. And so if you combine this biological and behavioral link with bars being some of the only safe spaces for LGBTQ folks to meet in, it can be concluded that bar culture does really play a key role in elevating the smoking rates of the community.
Another huge factor in the large rates of use within the LGBT population is direct targeting by the tobacco industry. Much like with the rural populations, the tobacco industry strategically targets the community. And many of you have probably seen this before, but in 1995, R.J. Reynolds revealed their plans to target the LGBT population in the Castro and the homeless population in the Tenderloin district. They wanted to increase their already high volumes of sales in those areas. They called it Project SCUM, Subculture Urban Marketing. But they weren't the first to do it. Project SCUM was in 1995, but in 1992, Philip Morris was actually the first tobacco company to advertise in an LGBT publication. They were met with a lot of debate within the LGBT community because many saw this as just one more addiction the community would be faced with, whereas others saw this as the community finally being accepted and respected as consumers. Ads started a lot more discreet and then eventually moved to more direct targeting. Like you see in the Parliament ad to the left, you see 3 people in that picture. The original ad only had 2, had the male leaning up against the wall and a woman in the water. What they did was add one more male to the picture, so you weren't really sure who the guy leaning up against the wall was looking at. And then all the way to the right, you see just you in blue. This is an electronic cigarette ad, obviously, depicting somebody who might be cross-dressing, and they're saying, just be you and vape blue. In between that time between the Parliament ad and the blue ad, you see ads like this. The tobacco industry was becoming more direct with their targeting as the times had changed and the LGBT population became more accepted. They sponsored pride events, made rainbow rolling papers, and even went as far as saying your freedom to smoke as an LGBT person was equal to your freedom to love. American Spirit really hitting on that in those 2 ads. All of these ads making it appear like they support the community. All the while, they donate tons of money to conservative politicians, especially in states that grow a majority of the tobacco plants. Another factor in the high rates of use were acceptance by the LGBT advocacy organizations. As I mentioned earlier, some LGBT publications wanted to allow tobacco ads to run because it showed to them that the tobacco industry accepted them. Looking back, we all know the tobacco industry's real reason for doing it, to hook more people and to make money. Between 2002 and 2004, University of California, San Francisco interviewed 74 leaders of LGBT organizations, and here's what they discovered. A large percentage of those leaders felt that tobacco use was not a pressing issue. Other issues needed to be addressed first, or at least ones that were not being addressed by the general population. Meaning, the general population was already working on tobacco use rates and trying to reduce those. Why do we need to work on this as an LGBT organization? Some said smoking and drinking were central to many people's coming out process. Again, remember that the importance of bar culture and social bonding. And for some, addressing tobacco use could be bad for their bank accounts. Many of them noting it was hard to defend taking the money, but it was necessary to keep their programs going and to help the community.
At this time, we would like to show you a short video produced by We Breathe of LGBTQ Californian stories with their tobacco usage.
I am a trans male.
Queer, non-binary.
Transgender male.
Bisexual.
Pansexual.
There are a lot of people who tend to struggle with mental health, and it kind of is underlying issues because they're part of the community. I am still struggling with tobacco use, trying to quit.
I gave up on therapy. Like, I feel like I have to explain my own identity. I know everyone knows that smoking is bad, but I guess there's no like incentive or like no resources to like help people that aren't, that are like trying to quit.
I was a smoker for a long time, going through divorce, having a child, coming out as transgender. You know, that takes a lot of mental health. I had my son and I quit. Nobody thought I was going to quit.
Like when you're in college and you're off your parents' health insurance and they don't really know what to do for you and you don't really know what to do for yourself, it can leave people in like really weird, vulnerable situations. Just the queer community in general, I feel like is more like susceptible and vulnerable to like the tobacco industry, like targeting people that have like alternative identities.
It's a continuous battle to identify what our triggers are. And I do admit I have anxiety more when I'm smoking. So I'm trying to get back to quitting because it's better for the family.
I wish the community wouldn't leave opportunities for minors to get a hold of it, because once you start, you can't kick it. People try and they always go back.
I know great things are going to happen for us. I know that, you know, if we just stick together and we build that community and we just keep doing the hard work of healing and really getting to the root of everything, like, we're going to be okay.
So now we'll pass it on back over to Shelley.
Great. Thank you for those videos. Michelle, why don't you tell us briefly about your interaction with Ty?
Okay, great. Thank you, Shelley, very much. This is Michelle with Tobacco Reduction of Amador County. I'm going to go ahead and advance the slide before I forget. I'm not seeing any controls on my end. Can someone advance that for me? Perfect. I don't like my picture, so I put a picture of the Grand Canyon to represent me. Being in nature, especially trail running, brings me a great deal of balance, and it's kind of how I recharge and relieve anxiety and stress. I grew up on the Central Coast of California, but I've been in rural Amador County for over 20 years. For a bit over a year now, I've been the coordinator for the Tobacco Reduction of Amador County Coalition. And like all coalition coordinators, I work to identify groups who lack a voice in our coalition. And I determined that we didn't have anyone who could help us connect with our LGBTQ neighbors, even though I knew those neighbors were there. but how to start. I knew one of our Amador County organizations, they host an LGBTQ support group, but they conduct a lot of outreach programs, and they represented on our coalition, but they weren't attending regularly. I met a few times with the support group coordinator, but I felt awkward. I felt hesitant, and I wanted to just come out and say, "Hey, join our coalition. I need you." But I felt like I just spun my wheels. Even though we had some really great talks, I just didn't get very far. So I retreated. I tried to take what I thought would be a safe route. I reached out to We Breathe with the intent of asking Danny to speak to our coalition. This would be perfect, I thought. It would be easy. I figured I could stay in my comfort zone and have Danny do the work. And so Danny and I emailed back and forth a few times, and we connected during the California Rising Health Equity Conference. And both Danny and Amanda were amazingly kind and supportive of me. However, they sent me right back to Amador County, and they encouraged me to reach out again to our local community, the LGBTQ community directly. Basically, they said to me, "We have your back, but you can do this." Well, that wasn't the easy answer I wanted, but luckily Danny and Amanda sent me to Ty. Ty Polskamp and his family are, in my opinion, legendary here in Amador County. They are inspirational advocates for those who lack a voice, whether LGBTQ members of our community, the homeless, youth. They're also big promoters of the arts and the farm to fork movement, and I'm probably missing a whole bunch more. So while I knew of Ty, I was really shy about approaching him. In my opinion, I had no credibility. I had no right to talk about LGBTQ issues. What if Ty didn't like me? What if he thought I was insincere? But I kind of pushed aside those doubts, and I connected with Ty via Facebook message. And we met for the first time at the Amador Art Council's Safe Space Art Show. And soon after, we met again at his family's cafe in Jackson. And Ty agreed to speak at our coalition. I was so honored. We used slides shared by Danny and We Breathe, and we began to build what we hoped would be a kind of a good custom presentation, not unlike today's webinar, but it also covered kind of had a focus on LGBTQ rural youth. And also, I asked Ty to please challenge our coalition, give us some ideas for how we can do better to support the health and well-being of LGBTQ community members. And at Ty's, it was Ty's idea. We ordered some rainbow welcoming place signs to distribute to our coalition members. Again, say, hey, let's all witness this. Let's all be supportive of our neighbors. So throughout the process, I made Ty promise me that if I said something wrong or presumptuous or hurtful, tell me. I knew, and my goal was to be an ally in more than just a name. Unfortunately, our April 8th coalition meeting had to be canceled due to the COVID pandemic. But I'm hopeful that Ty won't give up on me and we can find an alternative date this summer. Thank you so much for letting me speak today on this webinar, and thank you for Ty for working with me. I hope this is just the beginning of our partnership and that I can find more opportunities to build relationships with the larger LGBTQ community here in Amador moving forward. Thank you again, and hopefully, I think, Ty, you have some additional perspectives to share.
Yeah, thank you so much, Michelle. It really does make a big difference as a community organizer to have people in formal positions reach out, to the community directly, attempting to get our voices to the table where otherwise we are not represented. So I appreciate your effort in tracking me down, and we will definitely get to do that, the webinar the presentation for the local community when we're allowed to convene again. So in the process of talking with Michelle and kind of realizing that as I am not a smoker or a youth, it might be best to pull in some other perspectives. After we first met, I approached a couple of young people who have been attending our youth group, and one of them agreed to participate in creating the presentation for the local tobacco reduction coalition. And so Avery and I had worked on that a few times and met at the public library and went through, the shelves to see if there was any LGBT literature, and that sparked a whole other kind of book drive that's kind of going on in the background right now, as COVID definitely has taken the spotlight. But being able to connect people who are looking for resources and people who have never really been offered a voice in those type of arenas is really a wonderful position to be in here. So as Michelle kind of stated, I have a family business that is long-standing here. And because of that, the relationships that my aunt and my mom have built with the community over the last 30 years, we are something of a beacon for all sorts of resources in the area. And so, you know, giving youth their first job is one of the things that we focus on in our business, and giving them a space to grow and develop their own skills. And so that's the type of work that I like to do for the LGBT community as well, giving a young person the opportunity to speak to a room full of adults who, from the perspective of, you know, a disadvantaged family in the hills with queer family members, going to the doctor has not ever really felt safe for this young person, you know. So having, and it didn't feel safe for me either. So having the tables turn and an opportunity for us to share our voice in a way that where we are invited and respected is a game changer. Like I said on the slide about myself earlier, my opportunities for leadership really created a lifeline so that I could live through high school. So for the young people in the area, the more opportunities that we can provide them to take the floor and share from their voice what it is like to grow up queer in the foothills and what kind of challenges their families faced in accessing healthcare and moving through the public education system and all of that stuff. The more that we are able to do that, the more likely they are to grow up strong and healthy and to hopefully choose to reinvest in this area like I did after, you know, some time away. And then we can continue to build off of that sense of, you know, local pride. That's all I've got, I think.
Thank you, Ty and Michelle. Michelle, for sharing your experience in reaching out to Ty, and Ty for being so open and welcoming and being willing to share your experiences with us all. Quick time check, we are over time, but we do have a few very brief things to still cover and perhaps answer some larger questions. So please stay on if you have the opportunity, and we'll move forward as quickly as we can. So how do you break the ice? I think acceptance for all says it all. Acceptance of all. Start with an LGBTQ plus 101 conversation to get everyone on the same page. Practice the language. Share pronouns first. Don't make assumptions. I'll share my discomfort with the language. As I was growing up, I learned that queer was a negative and derogatory term. But my kind, gentle, supportive colleagues on this panel educated me that saying they took back the power of that word, and the term queer is their preferred descriptor and very much a term of personal and political empowerment and self-identity. So remember that making mistakes is okay. If someone calls you out on a mistake or you catch yourself, a quick apology is okay, but don't make a big deal about it and don't get defensive. We're all learning and we can all take accountability. So as you move forward in the process, remember that you can do this. You have the skill and you know how to outreach population groups. Be an ally. Like Michelle said, I'd like to challenge us to place a rainbow sticker in your office window. That is no small gesture. And rural projects, I hear you. I know that will not be an easy first step for some of us, and maybe in most places, but let's work together to explore ways to accomplish that first step. It's important because queer people look for outward signs of support and will seek help if they feel supported, understood, and welcomed. So we've prepared, We Breathe and Rise want you to feel prepared and supportive as possible. We've provided a list of great online resources that you can trust if you have quick questions and you want to look up something, or if you're looking for materials to share with your colleagues. We're also always happy to come and provide trainings and technical assistance to your department, and we'll make sure the recording of this webinar is available for you to access and share. So please, if there are final questions, you're welcome to ask those now. I appreciate you for staying with us. I appreciate any comments or questions you have that we can answer right now. Amanda, do you have any questions that have shown up in the question box?
Yes, so we have some questions about how important are smoking cessation counselors for helping clients that are LGBTQ?
Danny, do you want to answer that?
My apologies. Can you repeat the question one more time?
Yeah, the question was how important am I as a smoking cessation counselor to help clients that are LGBTQ?
It's actually really important. Just because someone is not out and visible as an LGBTQ client, you do not know if they're LGBTQ or not. So it's very important when we're first engaging clients is to introduce yourself, with your name and pronouns, and ask that person to introduce themselves with their names and pronouns. Speaking over this webinar, I'm pretty sure you can tell I have a very feminine voice, but I identify as male. So whenever I am on the phone with anyone that's a medical provider, and the moment they keep saying ma'am or miss or anything else, my defenses go right up, and I no longer want to engage with that person. No matter how many times I say, no, it's sir, my name is Danny, please stop calling me miss. I'm just turned off and I don't want to go back to that provider. So making sure that you have a welcoming and affirming practice is very important, because again, you never know who's going to call or walk in through those doors. I also want to commend Sharon and Gary from the Quit Line. They have done a wonderful job in updating all of their protocols, identifying LGBTQ champions and such. So if you want to know how you can implement this for your cessation services, I highly recommend also getting in contact with Gary and Sharon. And they can also provide you some direction as well with what they have done and what has been succeeding for them.
Great, thanks, Danny. So got a couple of other questions that just came in. One is, does the Smokers Helpline utilize LGBTQ counselors for LGBTQ potential quitters?
So the answer to that is that yes, they do have LGBTQ identified counselors as well as LGBTQ champions. And what Gary and Sharon have done at this Quit Line is they have 3 shifts over there, morning, afternoon, and evening. And each shift has that champion, that assists the other counselors with LGBTQ callers or transferring callers over to them, as well as navigating the different protocols. So that way, as someone who calls in and then is called back later in the future by maybe a different counselor, they're not being misgendered accidentally, but they're creating notes and protocols and ways to identify these are the pronouns the person utilizes, these are their experiences, and have undergone an in-depth training. So again, I highly recommend getting in touch with the Quit Line to see what they have created and what they have implemented, and how you can also implement it into your practices.
Yeah, and I can add to that too. Everything Danny said is correct. And it's not just the LGBTQ champions, though. The Quit line has really done a great job of making sure that every single person, every single counselor there receives LGBTQ cultural competency training, and that no matter who a caller or someone who's looking to get support with quitting, no matter who answers that phone and is on the other end, that they're going to be talking to someone who's supportive, who understands LGBTQ issues. And then they do have that additional support from those champions to, for when people do really want to talk about LGBTQ issues. So they've really done both. They've made sure that every single person who answers that phone is supportive. And then they've really built up an infrastructure of LGBTQ experts and champions within their ranks to help support cessation among LGBTQ tobacco users. And I think that's pretty much it for questions. I see a number of thank yous coming into the question box. But yeah, I think we've covered most of it.
Well, again, thank you everyone for attending. Please look for a post-webinar email. It will have a webinar evaluation, and remember that resources are available for you to download. We Breathe and Rise are here to help you in this process. Please contact us and we'll help you through the process. Thank you very much for sticking with us. And that concludes our webinar.